Assalamu alaikum dear viewers, welcome to Dr.Samî Medico. Hope so all you will be fine. Today our lecture is about contact lenses. So before to start the contact lens, all are requested to subscribe the channel and click on the bell icon, and don't forget to share and comment on the video. Coming towards our today lecture, that is spherical soft contact lens fitting and the effect of parameters changes. We will study about the introduction of soft contact lens, fitting philosophy, importance of centration, parameters for soft contact lens, prescribing method, lens fit assessment. These are the today outcomes of learning. What are the alternative names of the soft lenses in the past and present? Hydrophilic lens, hydrogel lens, gel lens, flexible, limbal and semiscleral. Limbal and paralimbals are the alternative names of soft contact lens. The total diameter of soft contact lens almost range between the 13 to 15 millimeter. Most common total diameter of the soft lenses are between 13.5 to 14.5 lens. And what are the fitting philosophy of soft contact lens? The soft contact lens should always be larger than the cornea, and the edge of the soft contact lens should not cross the limbus, otherwise the blinking action of our lids will disturb the position of the contact lens, and it will also decentrate the contact lens from the center of the eye. So the fitting philosophy is must before inserting the lens in the eye, otherwise the patient will also be disturbed and he will not see clearly. The vision will be blurred in case of the decentration of the lens. So it is must that the lens should be on the center and the lens should be larger than the cornea, and the edge should not cross the limbus. What are the requirements for the soft lenses? The soft lenses should be on the center of the eye, then conform to the anterior eye. The movement should be adequately, and the lens should cover the cornea in all positions. As we know that there are 9 gaze positions of the eye, so it should cover the cornea in all eye positions. Performance requirements are of the soft contact lens that the lens should provide us a good and stable vision, and there should be minimal physiological disturbance and be variable for practical periods, and the lens should be comfortable. These are the performance requirement, and the fitting requirements are should be on the center and move adequately and covers the cornea in all positions. As you can see in the diagram, the first diagram shows that the lens is on the center of the cornea. That's why x is also is equal to 0 and y is also is equal to 0. In other three diagram, you can see that the lens is not on the center of the eye, it's decentrated, and the values of x and y are different in other diagrams. If the lens is decentrated, a lens which is too loose will generally be excessively mobile and will not center well. Decenters significantly on down gaze but also does not completely cover the cornea. It is probably that in the up gaze position the lens will slide off the cornea almost completely. This lens is almost certainly uncomfortable and the vision must be affected because some of the lens periphery will cover the pupil. That's why the patient will not see clearly. So it is important that this lens should be on the center of the eye so that the patient can see clearly. What are the parameters for lens selections? Following parameters are important for the lens selection. That's our total diameter, BOZR, center thickness, optic zone diameter, water content, and material selections. These are the parameters we should see. The following parameters before the lens selection. The first one is total diameter. Measure the HVID. Now what is HVID? HVID stands for horizontal visible iris diameter. Then either add 2 mm to HVID and select trial lens. Set with nearest diameter or follow manufacturer's recommendation and selected suggested diameter. Larger diameter are often required with the higher RX to improve lens fit and centration. 0.5 millimeter added to trial lens diameter for high water lenses. Accounts for own eye shrinkage due to water loss. Thicker lens profile result in the greater lens or lid interaction. Means if the lens is thick, then it will interact with the lid, and the lid will disturb the center of lens. How we can measure the HVID diameters? The HVID diameters normally range from 11.6 millimeter to 12.0 millimeter. We can measure the HVID by Fidi rule, keratometer, and the eyepiece of slit lamp, photographic or video image. Now, what are the altering soft lens fit can change the total diameter and also BOZR. Coming towards the total diameter, an increase in lens diameter will tighten the fit if all other factors remain unaltered. This is because the sagittal height is increased. It means that if the sagittal height is increased, then the lens will tighten the fit. A decrease in diameter will loosen the fit. On the other hand, BOZR, if all factors remain unaltered, especially the total diameter of the lens, then decreasing the BOZR will stiffen the lens fit. Increasing the BOZR will loosen the fit. This is because these steps increase and decrease the sagittal height. Now, what is the rule of thumb? To retain the same fit, if the diameter is increased, the BOZR must also be increased to offset the effect the diameter change has on the ratio of sagittal height to total lens diameter. Retention of lens fit require an approximately constant ratio of sagittal height to total diameter. Increase diameter by 0.5 millimeter, then we should also increase the BOZR by 0.3 millimeter. If the lens diameter is increased by 0.5 millimeter, then the BOZR should be increased by 0.3 millimeter to retain the same fitting characteristics. The fourth point was that center thickness. So, thick lenses interact more with the lid and therefore move more on a blink. It means if the center of the lens is thicker, then the lid will interact with it and the lens will decentrate. If the thick lenses or the lens edge will also result in a greater lens decentration. If the edge of the soft contact lens is thicker, then the lid will also interact with it, and also the lens will be decentrated with the interaction of the eyelid due to thick edges of the soft contact lens. After thickness of the soft contact lens, we should also observe the material water content. Higher water content for decade over T advantage oxygen availability, and lower powers, low water content for easier handling and greater durability. It means if the contact lens has high water content, the oxygen availability will be more, and if the lenses has low water content, then it will be easy to handle and also have greater durability. Now, what are the effect of changing the water content? Any factor which alters lens rigidity alters the fitting behavior of a lens. A lower rigidity increases lens conformity within the post-lens tear film. When a lens material is changed to one with a higher water content, less movement is expected. So these are the factors which change the water content. Lens rigidity depend on method of manufacture, water content, thickness, and other material property. Now, the lens rigidity least with if the lenses are thinner, if spin cast manufacture, high water contents, and the lens rigidity greatest with thick lenses, late cut lenses, and low water material are material with MMA. What are the lens prescription methods? That's are two empirical, and the second is trial lens. These are the lens prescription methods. Now we will talk about one by one. Empirical prescribing, the patient data requires for lens choice are HVID, K reading, spectacle, RX, back vertex distance, interpalpebral aperture data. These are the following requirements for empirical prescribing. What are the advantages and disadvantages of empirical prescribing? Advantages are simple and quick for the practitioner. No trial lens is required, cheaper for manufacturer, no lens maintenance, storage by practitioner, no public health issue with trial lens reuse. Now disadvantages are exceptions always exist. Patients don't experience lens wear before delivery. Practitioners cannot observe patients' response to lenses. Fit is more complicated than just HVID and KS. The trial fit benefits are the following: allow the feel of a lens to be experienced, patient reaction is accessible, need to be performed in average illumination, assessment made with the aid of good illumination, low to moderate magnification, now easier and safer disposable trial lenses. These are the benefits of trial lens fit. Fitting descriptions: good, optimum, ideal on stiff, tight, bound, flat, loose, mobile, centered, decentered, low rigidity, high rigidity, superior, inferior, nasal, temporal, and combination of the above. These are the fitting descriptions. Trial lens sitting periods. Record the assessment after lenses settle. Sitting period normally 5 minutes. Further assessment may be necessary after 3 to 4 hours. Assessment during lens trial. The practitioner should observe the following assessments: that the lens should be on center, centration, position and moment, on blink with the eye, in primary position, lateral gaze, up gaze, rapid extreme lateral eye movements, lower lid push-up test in primary gaze, and edge conditions. These are the following assessments for the soft contact lens trial. So a practitioner should observe the following assessments during lens trial. Now coming towards centration and decentration, observe lens decentration under the following circumstances. Primary gaze should be 0.2 to 0.5 millimeter is more common. 1.0 millimeter is probably excessive depending on lens flexibility. Up gaze up to 1.5 millimeter acceptable. Lateral eye movement up to 1.5 millimeter acceptable. If the lens is between these range, so it means that the lens is on the center of the eyes. If the lens is out of this range, it means that the lens is decentrated. Now what is corneal coverage? In optical, its vision. In mechanical, prevent trauma of corneal limbus conjunctiva. Comfort: a decentrated lens, especially a mobile decentrated lens, may be less comfortable than a centered lens exhibiting optimal soft lens movement. What are the effect of a blink? If the lens is too steep, vision is clear immediately after a blink and then quickly revert to a lesser quality. The latter is due to tendency of the lens to attain an irregular spherical shape when standing up from the cornea. If the lens is too flat, vision is generally good in the primary gaze position, but the lens edge interact with the movement of the eyelid, so it will be obviously decentrated after the moment of the blinking action. Third point is lens movement. First of all, remove and displaces ocular debris, promote tear exchange, possibly aid epithelial wetting by mucin spreading and smoothing. Lens movement depend on the following properties: lens type, whether the lens is plus or minus, whether the lens is high or of low power, physical properties of the lens, material especially rigidity, and fitting relationships, which includes optimal, steep and flat. These are the following properties on which the lens movement depend on. Assessment of mobility we can observe by slit lamp, and also observe during moment on a blink eye moment on up gaze blink, and lower lid push-up test. Now what is primary gaze like? With the eye in the straight high-head position, the patient is instructed to maintain their eye position and don't blink. Lens leg is defined as the amount by which the lens trails the movement of the eye under stated condition. Up gaze lens leg assessment, the lens position is noted using any of the recording system. Lens leg is commonly assessed following supervision and the lateral version rather than in primary gaze position. As on the left side you can see that up gaze lens leg assessments, and on the right side there is lateral version lens leg. Here we can see the diagram which shows that the range of fits. If the lens is between 30 to 40%, it will be looser and it will be comfortable, having good vision, stable vision and corneal coverage. If it is between 40 to 50, it will be acceptable and ideal. If it is between 50 to 60%, then it will be tighter if it's thin, flexible and having high water content. And this picture you can see the conjunctival redness, and this conjunctival redness is due to the soft contact lens. Sometimes the soft contact lens cause the redness of conjunctiva in case of if the dust particles are between the soft lens and the cornea. And also conjunctival redness is caused by the movement of the soft contact lens if it is not on the center or if its edges cross the limbus. So it was the lecture of soft contact lens. Inshallah tomorrow we will study about the hard contact lens. Hope so you all have got the something from the lecture. Thank you for listening me carefully. Remember me in your prayers. Allah Hafiz.